most of history, cancer was considered a disease of affluence. It was something wealthy countries talked about. Countries with long life expectancy, good hospitals, and screening programs. But today, that story has flipped. Cancer now hits the bottom billion the hardest. The people living in the world's poorest countries, where diagnosis is delayed, treatment is scarce, and survival often depends more on where you live than how sick you are. I've always been struck by this inequality, and I wanted to see it, not through statistics, but visually. So I built a simple model using Insight Maker. Imagine compressing an entire health system into a digital village of 100 people. You give that village 3 sliders: resource level, early detection, and treatment access, and a play button that reveals who survives and who doesn't. It's not meant to be a medical simulator. It's meant to be a clear visual story about how a health system shapes life and death. So here we go. All 100 villagers start out healthy, but over the course of 20 simulated years, people move into 4 groups: healthy, undiagnosed, diagnosed, and dead. You control what happens with these 3 sliders: resource level, the quality of hospital staff and equipment; detection rate, how fast people are diagnosed; and treatment access, who actually receives care. Behind these sliders are constants, like the base cancer rate, survival rate, and death probability. With just these pieces, you can recreate the health trajectory of entire countries. Each simulated year, 5 things happen automatically. Number 1, some healthy people end up developing cancer. A small percentage does move into the undiagnosed group. Number 2, some people are detected. If the detection rate is set to be low, many cases go invisible for years, just like in low resource settings. Number 3, some diagnosed people get treatment and end up recovering. This only happens if treatment access and resources are high enough. Number 4, some diagnosed people end up dying. When resources are low, even treated patients have high mortality rates, something we rarely ever see in wealthy countries. Number 5, all the stocks update. Healthy shrinks, undiagnosed either grows or shrinks, diagnosed always changes, and the death just accumulates. This cycle repeats for 20 years, slowly revealing the story of the community. This model is simple, but it shows a massive truth. Cancer survival is not purely medical, it's structural. If policymakers, donors, or global health leaders played with this simulation for 5 minutes, they'd see exactly where to invest more money. Not in miracle drugs, but balanced systems. Early detection, treatment access, and resource strength do make a huge difference. A healthier world won't come from single breakthroughs. It'll come from making sure everyone, everywhere, has the exact same fighting chances. Thanks so much for taking the time to watch this video. I really appreciate your support and interest in this project. If you'd like to stay connected, you can find me on LinkedIn and follow my Medium page to read my latest articles. Both are linked in the description. Thanks again, and I'll see you in the next one.